Hi, I'm Nam. I'm a GP and a clinical lead for the NHS website. Should I wear a face covering? Everyone who can needs to wear something that covers their nose and mouth on public transport. Face coverings also need to be worn in shops and supermarkets, and when you go to hospital appointments or to visit someone in hospital. Children under 11 and people who have a legitimate reason, for example, people living with a disability and those with breathing difficulties, do not need to wear a face covering. Face coverings do not need to be worn outdoors or while exercising. For a full list of public spaces where face coverings are required, please visit gov.uk. The evidence suggests that wearing a face covering does not protect you, but it may help protect others if you have coronavirus but do not have any symptoms. If you have symptoms of coronavirus, or you live with someone who has symptoms, which includes people in a support bubble, you should stay at home. Only leave the house to get a test and do not get on public transport. Wash your hands or use hand sanitizer before putting your face covering on and after taking it off. It's important not to touch your face covering when wearing it, so you don't spread the virus from your hands to the face covering. Face coverings are not a replacement for social distancing and regular hand washing. A face covering is not the same as the surgical masks health and care workers use as part of personal protective equipment. These supplies should continue to be reserved for health and care workers to protect against risks in their workplace. You can make face coverings at home. The key thing is, it should cover your mouth and nose. You can find guidance on how to do this on gov.uk.